10,000 means analipa kwa mwaka 120,000. Alikuwa nakatwa with this 10,000 per month. Is it 15 or 10,000 per month? Lakini alilipiwa bill ya 17,000 out of 568 around there 1,000. Hi everyone, I hope this video finds you well. My name is Martin, in case you're here for the first time. Na sisi ni watu wa insurance. We do reviews on insurance and also we do civic education on matters insurance, especially we touch on Kenyan market. So if you are new here and you'd really love to know anything about insurance, we always recommend that you send a question in the comment section and we will do a detailed video to help you understand, and also in the course of helping you, we help our audience understand this market well, because we say the insurance is quite complicated sometimes. If you're not careful, you might end up getting frustrated because of lack of information. So we are here to give you information and we do it generously. So we are really sorry for the time that we have not been able to post for the last 5 days or so. We had a technical issue and we have been trying to sort it out, but eventually we have been able to sort it out and we are back like we never left. So keep those questions coming and we'll be happy to address them. Now, in our previous videos, like 2 videos, we have been talking about pension and tax and how they are related, and more specifically for those people who have had employment from different employers, lakini umetoka ama literally umetoka kwa employment and you want to pursue, or maybe you have gone to pursue your other ambitions. So in your previous employments, kuna hizo deductions huwa zinafanywa NSSF, hizo nini, all those deductions, and maybe to be precise, pension. So you have been limiting pensions but from different employers in the past, lakini hujaipata hiyo opportunity ya consolidate your pension. So we have been talking about what happens if you want to withdraw your pension before the age of retirement at the age of 50. What happens in terms of taxation? How much tax do you pay to get your pension? So we covered 2 videos, and as I promised you that we are going to do a series of videos, but in today's video, just allow me to digress kidogo, because I want us to do this with my partner, that is Elijah Moi, because we are able to have conversation that is going to lead us to cover quite a lot. So in this video is a bit different because of something that I experienced in the course of the past few days that we were not posting. There has been this confusion around SHIF and SHA, and most people are complaining that SHIF and SHA is not working. If you have a hospital bill, they are not paying as much. Maybe I have seen 2 videos. I have seen 2 people complain about mtu ako na bill ya over 500,000, but SHA ama hiyo SHIF imelipa 17,000. So in short, is paying way less, even in terms of contribution. If you are looking at how much people are contributing nowadays as compared to the way we used to contribute during the NHIF era, so it's quite it's not making sense, as in you are paying more as compared to the previous system, that is NHIF. But NHIF kitambo ilikuwa nalipa vizuri ukicompare na SHA. So this week I got an experience from someone who is close to me. Alikuwa na bill kubwa, but SHA did not respond the way he was expecting. I'm curious to know your personal experience in case you have gone to the hospital na umejaribu kutumia hii SHIF and SHA. So in today's video, I just wanted to take you through some of the comments, or maybe we review what people are saying about SHIF and SHA, because if you haven't registered, you also need to look for alternatives to supplement this SHIF and SHA thing, because it's very unfortunate if you go to the hospital na umekuwa ukilipa religiously kwa hii system ya SHIF, lakini ukienda hospitali they are not going to pay for you. So you also need to look at the alternatives, that is in terms of insurance, because nowadays they are very affordable medical covers with insurance companies. If you compare it how much you are paying for SHIF, unaweza pata maybe very nice medical covers that are going to complement. Sisemi usifanye registration ya SHIF and SHA, it has its own bit, But for you to be fully covered, you also need to have an insurance cover or medical cover. And if you are looking for budget, we're also going to look into which are the options in the market that can help you maybe look at budget and still get some cover. Okay, so that is exactly what I'm going to look at. And remember, they are looking at different factors when it comes to tabulating how much you need to pay per month. So kuna watu wanalipa even 3,000, 5,000. If you look at 5,000, for families which are paying 5,000, it means at the end of the year you are paying 60,000. So I don't want you to sitai kusema tukose kulipa SHIF ndio uchukue private cover, but we are going to be very objective. If 60,000, if you are paying 60,000 for SHIF and SHA, and in case of a medical bill unalipa, like the case I'm going to show you right now, anasema alikuwa nakatwa this 10,000 per month. Is it 15 or 10,000 per month? Lakini alilipiwa bill ya 17,000 out of 568 around there, 1,000. Bill ilikuwa over 500,000, akalipwa 17,000 na alikuwa nakatwa 10,000. So if you look at that scenario, 10,000 means analipa kwa mwaka 120,000. So if we look at the market, that is insurance, what they are providing with this for this value, we want to be very objective. Again, don't misquote me. I'm not like saying you stop paying SHIF and SHA, but let's be objective at what is available in the market with the same value. Okay, so let me just go through this review and then we'll be able to understand where I'm coming from. So here are some of the sentiments, and I'm going to, these are very long post, but basically this is someone who was in the hospital and they experienced SHA and they decided to share with us. This is on X, and I'm going to go through this post very fast. I'm not going to read the whole of it because it's quite long, but we are going to do a highlight. Now, this is someone who has registered with SHIF, and the employer has been remitting religiously more than 10,000 per month, as I said. So this 10,000 means is around 120,000 per year. And then he said that he went to the hospital, but the hospital declined to that is let me just read the way it is. Tuesday last week, I was admitted at Aga Khan Hospital, and the first attempt to use SHA was declined that I'm ineligible. Upon follow-up at SHA offices, they said I have to take physical copies of proof of my remittance, which was done. They then activated my eligibility on my that day of admission, and they said they can't backdate, so they couldn't pay my first 2 days of admission despite me being active contributor to the fund. Upon discharge, with a bill of 587,000, the fund only paid 17,000. Okay, so if you follow those bills that SHA has been paying, you will realize most of them have never remitted any monthly contribution to the fund. So it's quite unfair for someone who has been paying 10,000. That's quite a lot. So they deserve to be compensated or to have their bills paid in the hospital. Now he says, we have moved beyond the issue of whether SHA is working or not and must address the real issues with operationalization of the fund. Let's get politics out of the fund, bring professionalism, and that will make sure there is efficiency and all gray areas are sorted. Otherwise, there's a lot of confusion and Kenyans are suffering. But bloggers are happy because they are being paid to parrot and shout the success when it's so evident something is wrong. By God's grace, I'm fine and already reported back to my office, as you can see. So he posted these images. This is Aga Khan Hospital, and then this is the gentleman, and here is the bill. So this is the bill. Bill imekuja 587,007 bob, but SHA paid 17,920,000. So this client ended up paying 568,000. Whereas he has been paying is kind of, SHIF na SHA sin insurance. So amekuwa akilipa SHIF and SHA 10,000 religiously per month, but bill yenye amelipiwa is kind of ile contribution yake just 2 months was sufficient to cover up for what SHIF paid. So it's quite unfortunate, and this is what we are talking about. I hope
you guys, let's look another post. Someone else. So this is Rain. Rain is saying, I have analyzed like 7 bills. SHIF is paying 9%. SHIF is paying 9% while patients are forced to pay 91%. It's like SHIF was designed in this manner. It can't be coincidence for all the bills. This daytime robbery.
So let me know in the comment section what your personal experience has been with this SHIF and SHA. We want to understand. Maybe those people who are vocal is because they have had a bad experience. Maybe yours has been different. Where umelipiwa bill. Let us know in the comment section. And if there's something that you want to know about SHIF and SHA, you can always send us that question. We'll be able to do some research for you and do a video for you, and just to help you understand. So thank you very much for watching this video to the end. I hope you are getting value for your time. And if you haven't subscribed, kindly do so. And that's the best way to support us. And also share and leave a comment in the comment section below. And also like this video. Help us push these numbers, because we need to talk this truth to as many people as possible. So until we see you in the next video, God bless you and bye bye.